So now I am going to tackle the last topic for chapter 5, which is the educational approaches for students with mental retardation. First is the curriculum for educational approaches. So there is a number of curricular programs for children with developmental disabilities are implemented in the United States and other Western countries. The Cognitive Curriculum for Young Children, or the CCYC, is a major curriculum effort that is based on Piaget's theory of cognitive development, Vygotsky zone of proximal development, which has three stages. First is tasks that learners can do without assistance. Second is tasks learners can do with assistance. And lastly, tasks that learner cannot do even with assistance. And the Feuerstein's concept of mediated learning. Mediated learning is a structured approach to learning applicable for all age groups. CCYC builds its instructional program around the child's deficits in cognition where mediated learning is applied. Another intervention program is the Instrumental Enrichment Program, which are designed to enhance students on how they think and how they learn. They learn wherein the child is trained to develop a sense of intentionality, which is a sense that are always directed on something, and a feeling of competence as a result of structured mediated learning environments. Next is the Montessori method, which aims to develop the child's sense of self-mastery in the acquisition of skills in self-care and daily living activities. Curriculum and related instructional strategies in the Ypsilanti Perry Preschool project derived from Piaget's cognitive development theory. The cognitively oriented curriculum is used in teaching disadvantaged children with mild retardation who are 3 to 4 years old. The Portage project used the precision teaching model to deliver a home-based curriculum in language, self-help skills, cognition, motor skills, and socialization. Example is the parents are trained to teach their children using behavior modification procedures. The Carolina Subsidiarian Project includes parent training, social work services, nutritional supplement, medical care, and transportation. Its curriculum is designed around the interaction of consumers' opinions or the goals that parents have for their children. Piaget's developmental theory, developmental facts, which is the language, motor, socio-emotional, and cognitive or perceptive, and adaptive sets, which is the winning strategies that generate age-appropriate success, and the high-risk indicators. Now we will going to proceed the method of instruction for teaching children with mental retardation. Teaching children with mental retardation requires explicit and systematic instruction. So this is the one such method of teaching is the applied behavioral analysis, or the ABA, which is derived from the theory and principles of behavior modifications and the effect of the environment on the learning process. Next is the task analysis, is the process of breaking down complex or multiple skills into smaller, easier to learn subtasks. Next is the active student response, or the ASR, or the observable response made to an instructional antecedent is correlated to students' achievement. Systematic feedback through positive reinforcement is employed whenever needed by rewarding the students' correct responses with simple positive comments, gestures, or facial expressions. Meanwhile, incorrect responses are immediately corrected by asking the students to repeat the correct responses after the teacher. The application of learned skills in natural environment is emphasized in the transfer of stimulus control method of instruction. Correct responses are rewarded through positive reinforcement. I will going to proceed in educational placement at alternatives. In the past, children with mental retardation were usually placed in self-contained classes. The special curriculum emphasized the communication skills, communication arts, mathematics, self-help skills, social and recreational skills, motor skills, and pre-vocational and vocational skills. Though this traditional approach is still relatively common, increasingly students with mental retardation are now included in mainstream schools and even regular classes. Next is the students with mental retardation in inclusive education. When students with mild or moderate mental retardation are enrolled in regular classes, the regular teacher and the special education teacher work together to help the child attain the goals and objectives set for the school year. The educational placement is called inclusive education because the regular class has a student with a disability who has been assessed to be capable of learning side by side with normal students. The Individual Education Plan or the IEP is prepared by the teachers and parents to identify and indicate the goals for the school year and the objectives and activities during the 4 quarters or grading periods for successful inclusive education. So, as mentioned earlier, the child attends the regular class and receives tutorial lessons from the special education teacher. And the family members' needs are encouraged to help the child with assignments and class requirements. Mainstreaming is the activities for children with the more severe forms of mental retardation or are more selective. They participate in social activities, sports, and co-curricular activities like Special Olympics, camping, scouting, and interest clubs. The activities center on peer interaction, improving social skills, and helping non-disabled students become more comfortable when interacting with persons with disabilities. In mainstreaming, the teacher faced with the challenge of providing an optimal educational experience for those with mental retardation, the justification for the students' presence in their classrooms is a lethal consequences. Rather, their concerns focus on the practical matter of how best to teach them. Fortunately, there is a growing body of knowledge regarding appropriate techniques for the teaching students with disabilities in regular classroom settings. Some suggestions for the special education teachers and the regular teacher in whose classes students with mental retardation are mainstreamed. First is the teachers need to study the student's IEP or the individual education plan and agree on the teacher's rules and responsibilities to make inclusive education and mainstreaming work. Second is the teachers need to set regular meetings with each other or with the students or the families to assess how effective the program is going and what else needs to be done. Third is the teacher needs to encourage acceptance of the student by classmates by setting an example and giving the students the chance to show that he or she is more like the others than different. Fourth is the teachers need to use instructional procedures that will be of benefit to the students, such as demonstrating the more complex and difficult tasks and providing multiple opportunities for practice. And lastly, when teaching abstract concepts, provide multiple concrete examples. In subtotal, regardless of a personal level of functioning, transition services will be an important part of his or her special education program, particularly at the high school level. These services provide the bridge to life after school and help the individual in both community adjustment and employment. Typically staffed by full-time transition specialists, these programs not only provide vocational training but also focus on issues such as job responsibility, social interactions, and home and community living skills.